Hi everyone, my name is Juliana Cardillo and this is my special population presentation on end-of-life care. So just some information about the population. End-of-life care has different aspects, palliative care and hospice. So palliative care is the management of physical, psychological, and pain to improve the quality of life of the patient. So the role of the social worker is to educate the families about the symptoms, pain management, medications, and to help the family make medical decisions. Hospice is a little bit different. It just focuses on the comfort of the patient who is reaching the end of life stage. So the role of the social worker in this case is to provide supportive care to the patient and the family. You help the patient cope with the symptoms, but you're also helping the family cope with the range of emotions that they are feeling when the patient is approaching the end of life stage. So a little bit more information about the population. So the majority of individuals who are receiving end-of-life care often have chronic diseases such as cardiovascular diseases, cancer, respiratory diseases like COPD, CHF, diabetes, AIDS. Other individuals might have conditions like liver disease, end-stage renal failure, neurological diseases, and dementia. So working with this population is different from others. So like I just said, the people who are in end-of-life care suffer from a variety of chronic illnesses. So the social worker in this case has to really have an education and an understanding about the medical field and the background. And this also is pretty unique because end-of-life care can affect any age group. So a social worker in this field, might work with infants and children, teenagers, adults, geriatrics, and also continuous education is kind of what makes this population different from others because you're working with such a variety of individuals. So it's important to have the proper education to provide the correct support. And what's different about this population is that the ultimate goal is just to keep the patient comfortable. The social worker knows that the patient, unfortunately, is not going to get better. They're just trying to keep the patient comfortable during the end-of-life stage. So the role of the end-of-life social worker is very unique. So the social worker has a variety of tasks that they perform throughout the day. So end-of-life social workers take a biopsychosocial approach when working with this population. So some social workers provide counseling, psychosocial education, crisis intervention, discharge planning, whether it be helping a patient go home with home hospice, making sure they have the correct equipment at home, making sure they have a visiting nurse coming, or, sometimes discharge planning just involves getting them to an inpatient hospice unit. So the end-of-life social worker performs a variety of tasks throughout the day. So two main challenges that are specific to this population are lack of access to care and inconsistent communication. So lack of access to care really focuses on financial responsibility, working with individuals of low economic status. So financial responsibility is a big one when it comes to end-of-life care because unfortunately people aren't educated enough about the differences between Medicare and Medicaid. Some people aren't even aware about Medicare Part A and that's your hospital, and Medicare Part B is doctors, and they don't really understand Medicaid as well. Unfortunately, some people who have low economic status don't have Medicaid. So if a patient were to have no income or they're experiencing homelessness, they wouldn't have the accessibility to be on a hospice unit. So the article that I chose focused on homelessness in people who were at the end of life stage. So people experiencing homelessness are at a greater risk for short life expectancy and have higher rates of mortality than the general population. So that is definitely a barrier and a big challenge when working with this population. Another one is inconsistent communication. So the lack of communication between patients and healthcare team is a big problem. So the lack of provider information and awareness on how to provide care and communicate with these marginalized groups is an issue. I work at a community hospital, and I work in the case management and social work department, and I see this very often where especially in end-of-life patients, doctors are unaware of what the financial responsibility is, especially for people who are inpatient hospice appropriate. And sometimes the lack of information that they have when speaking to a family member presents an issue, because there definitely is a communication issue. And unfortunately, that is something that the social worker would have to deal with. So as a social worker working with this group, I would prepare to address these needs by being culturally aware. Like I said before, a social worker in the end-of-life field works with a variety of people who are different ages, different social economic backgrounds, different cultures. So being culturally aware would be very beneficial in this situation. Keeping up with education and CEUs is a big one. End-of-life care always is evolving. It's important for the social worker to be up to date with policies and procedures. Also, it's important for the social worker to gain experience. I just think of it as if I was the family member discussing hospice or palliative care with the social worker, I would wonder what experience they have, when discussing such a serious situation about my loved one. So experience is a big one. And being a vital member in the multidisciplinary team is also a way to help prepare to address these issues, because as the social worker, we have to be flexible. We are advocating for our patient. So it's important for us to make a stand for our patients so they get the proper care that they need. And it's also important for the social worker to have the ability to be present in the moment with patients and their families, especially when they're talking about such a hard topic and the family and the patient are experiencing so many different emotions and feelings. It is important for the social worker to be present, to be empathetic, to be sympathetic, to address these challenges. So some resources I would need as the social worker would be to have a supportive multidisciplinary team. So that would be physicians, whether it be the attending, the palliative care physician, nurses on the floor, the pharmacist, a case manager, home care, family and the patient. That's very important for the continuum of care for the patient. It's also important to be up to date for your trainings, education, CEUs, because that's going to help me as a social worker keep up with my professional and personal development, and continuing education to gain psychosocial expertise and attention to social determinants of health. So pretty much that is just going to help me remain culturally aware and understand that, sometimes people and patients aren't getting the proper care that they need, not because they don't want to, it's because they don't have the means to do so. For instance, someone who is homeless is not going to have money to buy diabetic supplies if they're a diabetic. They're not going to have the transportation needs to get to doctor's appointments. So getting the continuing education will just bring attention to the social determinants of health to the low economic population who are receiving end-of-life care. So my question for the class is, how can we develop a system of care that is trauma-informed, culturally sensitive to improve health equity in the context of end-of-life care? Thank you for listening to my presentation on end-of-life care, and these are my references. Thanks.